Welcome to this explainer. Today, we're taking a really deep dive into a medical condition that is incredibly common, yet honestly so widely misunderstood. We're going to demystify osteoporosis and hopefully transform it from what a lot of people falsely believe is just an inevitable part of getting older into exactly what the medical science shows it to be. A preventable, manageable, and highly treatable condition. We've brought together the absolute latest clinical guidelines to give you a clear, structured look at exactly what's happening right now inside the human body. 200 million. Wrap your head around that for a second. That staggering global figure represents the estimated number of people worldwide who are silently losing their structural foundation, their actual bone mass, right at this very second. It is a massive global health issue, spanning continents, affecting postmenopausal women, older adults, and yes, even younger people with certain chronic conditions. But you gotta wonder, how does a condition affecting hundreds of millions of people go unnoticed for so long? Well, that brings us to our first major question. Medical professionals often refer to osteoporosis as the silent disease or the silent thief. And that is because this thief is incredibly stealthy. Unlike arthritis, which, constantly announces itself with daily joint pain and stiffness, osteoporosis sneaks in and hollows out your bones without setting off any alarms whatsoever. There are virtually no warning signs, no aches, no fevers. For most people, the absolute first symptom that this silent thief has been hard at work is a sudden, devastating fracture from a completely routine movement. All right, here's our roadmap for today. We're investigating this like a detective story. First up, the crime scene, then the heist, followed by the targets. Next, catching the thief, and finally, fighting back.
Section 1. The crime scene. Let's take a look inside a working skeleton.
We tend to think of our skeleton as this static, dry museum display, right? But in reality, it's a bustling 24/7 construction site. Actually, your body completely replaces your entire skeleton about every 10 years. Your bones are dynamic, living tissues, locked in a constant metabolic battle. They have a blood supply, they have nerves, and most importantly, they're constantly breaking themselves down and rebuilding themselves. This lifelong process is called bone remodeling. Your body is continuously clearing out old, micro-damaged bone and laying down fresh, strong bone matrix right in its place. So let's meet the cellular workforce behind this whole operation. You basically have two main crews on your construction site. On one side, the osteoblasts. These are your bricklayers. They're responsible for bone formation, actively laying down new calcium and collagen. On the other side, we have the osteoclasts. This is your demolition crew, responsible for bone resorption, which effectively clears away the old bone. Now, in a healthy young adult, these two crews work in perfect, beautiful harmony. The demolition crew clears a spot, and the bricklayers immediately fill it right back in.
Section 2. The heist. How bone is actually stolen.
So what happens when that cellular harmony just breaks down and the demolition crew starts working overtime? Well, that physiological shift is exactly how the silent thief pulls off the heist. Step 1. Resorption simply exceeds formation. The osteoclasts are breaking down way more bone than the osteoblasts can ever replace. Step 2. The inner spongy bone, known as trabecular bone, begins to thin out, losing that intricate honeycomb-like microarchitecture. Step 3. The hard outer shell, the cortical bone, also gets thinner. By step 4, the bones have become highly fragile. The structural integrity is so compromised that even minor trauma, we're talking a simple sneeze or just bumping into a coffee table, can cause a bone to completely snap.
Okay, so when does this heist typically happen in our lives? Well, we hit our peak bone mass in our 20s. That's when your fortress is at its absolute strongest. But in our 50s, particularly for women going through menopause, there's a sharp drop in estrogen. Estrogen is a crucial hormone that actually helps keep those demolition osteoclasts in check, so when it drops, bone loss accelerates rapidly. Then, as we move into our 70s and beyond, we see the progression of senile osteoporosis, which is simply driven by the natural aging of our cellular processes.
Section 3. The targets. Spotting the risk factors.
Who exactly is this silent thief looking for? While age and menopause drive primary osteoporosis, secondary osteoporosis can be triggered by external factors at any time. Being female and over 50 are the biggest primary factors for sure, but take a look at your lifestyle and medical history. Long-term corticosteroid therapy, chronic illnesses, deficiencies in vitamin D or calcium, a sedentary lifestyle, smoking. I want you to mentally run through this list. Do you fit this profile? Does a parent? Does someone you love? Recognizing this is literally the first step in outsmarting the disease. When the thief does strike, these are the primary targets for a structural failure. The hip is definitely the most notorious and, frankly, the most dangerous. Then there are vertebral compression fractures in the spine. If you've ever noticed an older relative gradually losing height or developing a stooped, hunched posture, that's clinically known as kyphosis or a dowager's hump. That is very often the result of microscopic spinal fractures quietly collapsing over time. The wrist and the upper arm are also incredibly common targets, usually when someone instinctively puts their hands out to catch themselves during a fall.
Now, I want to take a second to be very serious here. Because osteoporosis is silent, you absolutely need to know what a structural emergency looks like. If you or a loved one experience sudden severe hip pain after a fall, an inability to bear weight or even walk, severe back pain after just a minor bump, or any visible limb deformity, you have to seek emergency medical evaluation immediately. These are not things you just walk off. These are the catastrophic end results of the thief's work.
Section 4. Catching the thief. Diagnosing early.
The entire goal of modern clinical management is catching this bone loss well before a catastrophic fracture ever occurs, and the gold standard to do this is the DEXA scan. It's a specialized test that simply measures your bone mineral density. The scan gives you what's called a T-score, which compares your bone density to that of a healthy young adult. A T-score of -1.0 and above? Totally normal. If you drop between -1.0 and -2.5, you have osteopenia. And if you drop to -2.5 or lower, you are officially diagnosed with osteoporosis.
It's absolutely crucial that we clearly distinguish between those bottom two. Osteopenia just means you have low bone mass. The thief has broken in, sure, but the damage isn't severe yet. This is your early warning siren. It is your golden opportunity to intervene. Osteoporosis, on the other hand, means severe deterioration has already occurred, and you're at a very, very high risk of fracture.
Now, alongside the DEXA scan, your doctor will likely use a tool called the FRAX score. This is a pretty brilliant diagnostic algorithm. By plugging in your bone density results, along with your age, your weight, personal habits, and family history, the FRAX tool predicts your highly personalized 10-year probability of suffering a major osteoporotic fracture. It really takes the guesswork out of treatment and helps doctors tailor a specific plan just for you.
I want to pause on this quote from the clinical literature because I think it's so powerful. Osteoporosis is treatable but not completely reversible. Early diagnosis improves outcomes. See, this shifts the entire narrative from fear right over to hope. Yes, once the bone architecture is severely damaged, we can't completely rebuild it to a 20-year-old's level. But if we catch it early, we absolutely can halt the thief in their tracks, significantly reduce that fracture risk, and preserve a really high quality of life.
Which brings us to our final part, Section 5, Fighting Back. Rebuilding the fortress.
So, once we've caught the thief, how do we actually rebuild our fortress? First, we tap into the medical arsenal. The most common frontline meds are bisphosphonates, like alendronate. We've also got SERMs, targeted biologics like Denosumab, and in some cases, hormone replacement therapy. Complex pharmacology aside, how most of these basically work is by targeting the demolition crew. They slow down or completely disable the osteoclasts, allowing your brick-laying osteoblasts the precious time they need to fill in the gaps and stabilize that bone matrix.
But listen, medication alone just isn't enough. You have to put your bones to work. There's this physiological principle called Wolff's Law, which states that bones will adapt to the actual loads placed upon them. If you want the bricklayers to work hard, you have to give them mechanical stress. That is exactly why evidence-based physiotherapy heavily favors weight-bearing exercises. We're talking brisk walking, stair climbing, low-impact dancing, over non-weight-bearing exercises like swimming or cycling. Sorry to the avid swimmers out there, but your bones need gravity. Because water supports your weight, it just doesn't trigger bone formation in the same way.
Furthermore, physical therapy goes way beyond just stressing the bones. A huge part of this fight is preventing the event that causes the fracture in the very first place, the fall itself. So progressive resistance training to build the surrounding muscle, postural and core strengthening to really protect the spine, and intensive balance training are paramount here. Honestly, a solid fall prevention program is arguably just as protective as the bone medication itself.
Finally, you need to supply your construction site with the right materials. This is your nutrition fortress. Your bricklayers absolutely require adequate calcium as their primary building block, and they need vitamin D to actually absorb that calcium from your gut into your bloodstream. Protein-rich foods, magnesium, and vitamin K are also essential structural cofactors. And equally important, cutting off supplies to the thief by limiting excess alcohol and quitting smoking, because both of those severely disrupt bone metabolism.
We have covered the science, the heist, and the clinical strategies to fight back. Osteoporosis might be a silent disease, but its mechanisms are fully understood, and the tools to defeat it are readily available to us today. So I want to leave you with this thought. Look at your routine today. Are your daily habits, your nutrition, and your movements actively building your bone fortress, or are they quietly holding the door wide open for the silent thief? The power to change that equation starts right now. Thank you so much for joining me for this explainer.